Thank you. Good morning, everyone. I'm Xin from the UCL. I'm glad to be here to share with you some of the policy implications based on our mental health and well-being findings using the evidence from data analysis from the COVID social mobility and opportunities study, Cosmo. Just a quick background. Cosmo is a new youth cohort study that provides evidence on socioeconomic inequalities in life chances for a generation of young people impacted by the pandemic and cost of living crisis. Next slide, please. So the policy implications. Our funding shows a significant proportion of young people are experiencing poor well-being and mental health, with 44% reporting high psychological distress, which is a notable increase compared to the previous cohorts over the past 15 years. This once again highlights the need for sustainable and well-funded support for young people experiencing mental health issues, including preventative and early intervention services to prevent future cohorts from experiencing such issues. Support should recognize and deal with major life events that a young person may experience during the COVID-19 pandemic, such as having non-COVID or having had to shield. Our research also finds that those in state comprehensive schools were far less likely to be satisfied with the mental health support offered by their school during the pandemic compared to those at grammar and independent schools. This inconsistency should be tackled by ring-fenced funding for mental health support in all schools that adequately recognizes the scale of support required by students following the pandemic. So funding should go towards implementation of a whole school approach to well-being, having access to an independent counselor for students, and introducing mental health support teams into every school. So mental health and well-being support should also be added to catch-up activities in schools and colleges for all students, with specific interventions for those with existing mental health issues. A proportion of funding for education-related catch-up should also be added to funding allocations and ring-fenced for mental health support. Our findings indicate poor mental health and well-being for those identified outside the gender binary. So more targeted support for non-binary and trans students is required to be delivered by professionals who have been trained to understand the needs of these young people. So furthermore, measures to reduce the risks faced by these groups should be included in both new national self-harm and suicide prevention plans, as well as local plans, with a national framework setting out how to do so. Next slide, please. Nearly a quarter of participants in our Cosmo cohort say that they have been bullied at school. So local and national strategies, therefore, should continue to be needed to tackle bullying at school, particularly dealing with cyberbullying on social media. All schools should implement a well-evidenced anti-bullying program. Such strategies and programs should recognize the heightened experiences of bullying and harassment identified for marginalized groups, such as non-binary plus individuals, and adapt plans accordingly. There's also association between a young person's mental health and the mental health of their parents. This suggests a need for well-being of children to be considered while mental health risks are identified in their parents. Last but not least, given the inequalities in accessing mental health support, improvements to mental health services in disadvantaged areas and disadvantaged schools is particularly important. Next slide, please, the last slide. So I'm aware of the time, and for more detailed research findings, including other areas for the inclusion of education, you're very welcome to go to our Cosmo website. Thank you.